In the previous class, I discussed about the lipid profile, mainly the triglyceride levels and cholesterols. And last class we discussed about the source of cholesterol and the level goal of to maintain our cholesterol levels. Last class I discussed that high level of cholesterol associated with the heart disease, but some drugs we used which increases the cholesterol levels, like the anabolic steroids, like the insulins, beta blockers, epinephrines, contraceptives and vitamin D. Cholesterol present in the blood in the three forms: low density lipoprotein, high density lipoprotein and very low density lipoproteins. So, very low density lipoprotein is not measured directly, so it is estimated from the triglycerides. This mathematical estimation of VLDL is not valid when the triglyceride level is more than 400 milligram per DL. So, LDL is another low density lipoprotein and it is called a bad cholesterol. You must recognize it, the LDL, the importance of LDLs. It is always treated as bad cholesterol because it carries cholesterol from the liver to the blood and then to the organs. So, LDL cholesterol is easily to stick to the vessel wall, or high LDL level in the blood associated with atherosclerosis, heart disease and even associated with the myocardial infarctions. LDL is calculated or it can be estimated both. So, LDL is a bad cholesterol. Why it is called bad cholesterol? Because the LDL carries bad cholesterol because it carries lipids from the liver to the blood and to the organs, and these LDL easily stick to the wall of the blood vessels. So, high LDL level in the blood associated with the atherosclerosis, heart disease and even the myocardial infarctions. So, goal of our LDL level is less than 130 milligram per DL. If less than 70 milligram per DL for those with the heart or blood vessels disease, and other patients have a high risk of heart disease. So, the gist is in the normal persons the LDL level should be less than 130 milligram per DL, but having the predisposing factors of atherosclerosis, heart disease, myocardial infarctions or chronic heart disease, in these patients the LDL level should be maintained less than 70 milligram per DL. Now, I will discuss about the HDL, high density lipoprotein. Sometimes the patient asks, the high HDL is above normals. So, we discuss or we advise the patient, if the HDL level is above normal, it is a good for you. For that reason, it is called the good cholesterol. It carries cholesterol from the organ and blood to the liver and get rid of it. So, it removes excess cholesterol from the tissues. So, HDL level, it cleans blood, and high level linked to reduced risk of heart disease and reduced risk of blood vessels disease. So, our goal of HDL is more than 40 milligram per DL. So, if anybody has a 60 milligram per DL, so a good level of HDL is 60 milligram per DL. That means the persons have relatively low risks of heart disease, and it can only be achieved by movement, by running, by exercise. So, you should do or try to maintain the HDL level more than 40 anyhow. So, our laboratory goal is that total cholesterol level should be less than 200 milligram per dl, triglyceride level should be less than 150 milligram per dl, and LDL level should be 130 milligram per dl. If the LDL level is more than 160, there is a risk, increased risk. HDL level, if have less than 35 milligram per dl, then the persons having the risk. So, if the LDL and HDL level is less than 3, ratio is less than 3, it is desired, and if it is less than 2.5 ratio, it is best. So, next I will discuss about the hyperlipidemia. You must know the hyperlipidemia, a condition of abnormally high lipids of any or all lipids or lipoproteins in the blood. Hyperlipidemia is a major modifiable factors for atherosclerosis, cardiovascular disease including the coronary heart disease. Primary hyperlipidemias are genetically based, but the genetic defects are known for a minority of the patients. So, what are the causes of hyperlipidemia? Secondary cause, it may result from such diseases such as diabetes, thyroid disease, renal disorders, liver disorder, Cushing syndromes, obesity, alcohol consumption, estrogen administration, and drug associated changes in lipid metabolisms. Thank you to you all. Today I will discuss in details in the next class about the secondary or hyperlipidemia or familial hyperlipidemia. Thank you to you all.